Another Fox News alert closer to home. Hospital officials in Texas keeping a close watch now on a patient showing signs of the Ebola virus. Senior national correspondent John Roberts live in Atlanta on this now. What do we know, John?
Good morning to you, Bill. Well, this one is in Dallas. It's at the Texas Health Presbyterian Hospital. Apparently, this patient arrived from visiting one of the affected countries in West Africa in the last couple of days, presented himself at the hospital with what we understand to be a high fever, also vomiting. Out of an abundance of caution because of the travel history, the hospital put him in a strict isolation unit. It is now sending samples to the Centers for Disease Control to find out if he is indeed infected with Ebola or if it might be some other disease. I talked with officials at the CDC this morning. They described this patient as being low risk, that this really is being done out of an abundance of caution. They expect to receive those samples this morning and may have a preliminary result by sometime this afternoon. Should be pointed out that there have been dozens of suspect cases, probably about 10 of which have actually had samples sent to the Centers for Disease Control for evaluation. Some of those have turned out to be malaria. Thankfully, none have turned out to be Ebola at this point. But Anthony Fauci from the National Institutes on Allergies and Infectious Diseases, who I happened to be chatting with yesterday, believes it's only a matter of time before somebody gets off of a plane from one of those West African nations infected with Ebola and brings it here to the United States, though he does believe that because of the strict protocols we have in place here for isolation and treatment, that it's likely that the infection would not spread too far after that, Bill.
John Roberts, thanks. Stay on it. We'll watch it from here.